Conversely, it may be hard for you to urinate for a few days or weeks. Sometimes up to 30 to 40% of women cannot urinate efficiently after surgery due to swelling or anesthesia. This may last a few hours to a few weeks. You may be required to use a catheter in your bladder to help it drain and retrain it to work properly. One kind of catheter, called a transurethral Foley catheter, may be placed into the bladder through the urethra. This is usually reserved for large pelvic reconstructive surgeries and timely recovery. Some patients prefer to use a catheter intermittently to empty their bladder. This is called intermittent self-catheterization, or ISC. It is an easy technique to learn and helps to lessen the threat of urine infection. A third kind of catheter is called a suprapubic catheter, or SPC for short. This catheter is placed through a small incision in the abdomen. An SPC is good for elderly patients or those who are obese and may not be able to insert a catheter, or for complex bladder surgery requiring delayed recovery. Other tubes may help drain fluid from your incision or incisions. Unless instructed to maintain a catheter to drainage or to rest, you will begin plugging the end of your catheter with a small plastic plug in the hospital, and you will leave it plugged for set intervals of time. You will continue this upon dismissal. While your catheter is plugged, the urine will not drain out of it, and your bladder will fill like it always has naturally. You will be sent home with a smaller day bag that straps to your leg for mobility, plus a larger night bag to allow you to rest all night without the need to drain the bag. And you will be sent with cleansing supplies. If you have a transurethral Foley catheter, plugging of the catheter helps to wake up the bladder and increases capacity. By the time you come in for your first post-operative visit, 95% of patients will be ready to pass a voiding trial and have the catheter removed successfully. During daytime, try plugging until you are comfortably full, then drain your bladder through the catheter. Your goal should be 2 to 4 hours of plugging between bladder emptying. You may put your catheter to drainage at night so you can get a good night's sleep.
In this film, you will learn step by step how to empty your bladder. It is relatively simple, but will require some practice. Start by washing your hands thoroughly with water and soap. Remember also to wash your thumbs. Alcohol hand gel can be used if you don't have access to washing facilities. Make sure you have all the equipment you will need before you start. You will need a catheter of the appropriate size, intimate wipes or soap with a neutral pH value, and water, and perhaps a mirror which can be fastened onto your thigh. Pull your clothes down so you can move freely when doing the catheterization, and sit down on the toilet. If you are able to urinate, always try before you use a catheter. The catheter is protected by a tube that must be separated from the catheter before use. First, hold the catheter with one hand at the lower section. Then break the transparent label by twisting the upper part and the lower part in opposite directions. Keep the catheter vertical and pull the two parts apart until you feel a slight resistance and hear a click. Bend the upper hand slightly forwards and backwards to release the catheter. Empty the water from the lower tube and keep it for later disposal of the catheter. The catheter itself must be placed standing on an even surface where you can easily reach it. Make sure that you do not touch the lubricated part with your skin or clothes. To prevent pushing bacteria into the urethra and bladder when you use the catheter, you must first clean the area around the urethra properly. This might be easier for you if you fasten a mirror onto your thigh. Spread the labia apart and wash the opening to the urethra. Wash from front to back in order not to transfer any bacteria and cause an infection. Use each wipe only once. Make sure that the catheter does not touch anything before you insert it into the urethra. If it does, you must use a new catheter. Touching the sink or your clothes or skin, for example, will contaminate the catheter and can potentially cause infection. To make insertion of the catheter as easy as possible, it is important that you relax. Slowly and gently insert the catheter into your urethra. Make sure you use gentle movements. Continue to insert the catheter until it reaches your bladder and the urine starts to flow. Then continue for a few more centimeters. When the flow stops, move a little and straighten yourself up to make sure that the bladder is completely empty. Withdraw the catheter slowly to ensure that you drain any remaining urine at the base of your bladder. You can dispose of your catheter and the packaging in your household rubbish. Do not flush it down the toilet. Wash your hands, and you have completed the process. The catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film are only intended as follow-up to the advice you have already been given.
If you are performing intermittent self-catheterization, you should attempt to urinate every hour or so and then catheterize at the end of the time interval to measure how much urine is left in the bladder by emptying the catheter into the measuring hat that you set in the toilet. If you have a suprapubic catheter, during the time that your catheter is plugged, you should attempt to urinate naturally every hour or so. At the end of the time interval, measure how much urine is left in the bladder by emptying the catheter into the measuring hat. You will not begin progressing through the different levels of the suprapubic plugging or intermittent catheterization routine until you are able to urinate normally through your urethra. Until this happens, you will repeat the 4-hour interval over and over. When you have started urinating normally, you will measure how much is left in your bladder at the end of each interval and make a decision about whether you may progress to the next time interval. Please see the respective catheterization routine pertinent to the type of catheter that you may have. Until the 12-hour interval is reached, the catheter should be hooked to the drainage bag every night to drain. After the first successful 24-hour interval, please call the office to update one of the nurses. Now, let's talk about troubleshooting the catheter. It is not uncommon for the transurethral or suprapubic catheter to leak around the urethra or skin incision respectively as the bladder gets too full. If you have problems with this type of leaking, drain your bladder through the catheter. If leakage continues, reconnect your catheter to the Foley bag until the next morning, then restart the plugging routine. Please call the office with continued leakage problems. The site where a catheter is inserted into the urethra or abdomen may become pinkish, purplish, or develop a yellow or crusty substance around it. These are your body's natural reactions to the catheter's presence and are very normal. You may wash around the catheter daily with warm soap and water. Rinse and dry these areas well. You may shower while wearing the catheter. Maintain good personal hygiene. If this site develops a redness that spreads, or is warm and painful to the touch, or develops copious amounts of pus, please call the office immediately. You do not need to measure how much you urinate, ever. You need only to measure how much is left in the bladder, which gets drained from the catheter at the end of each plugging interval. This is known as the residual volume, or residual urine. You do not have to measure this residual every time you urinate normally, only at the end of the plugging interval. You may find it easier to use the Foley bag at night to collect your urine. Doing this prevents you from having to get up in the night to drain your bladder. If you use the Foley bag, simply restart your most recent plugging interval when you wake up. For example, if you were at the 6-hour interval before bed, start at this interval routine in the morning. When changing from one bag to another, use a clean leg bag or Foley bag and an alcohol prep. Wash your hands thoroughly with soap and water and swab the end of the drainage tubing that will be attached to the Foley catheter. Disconnect the drainage bag from the Foley catheter and put the bag aside. Attach a clean bag to your catheter. Wash your hands thoroughly afterwards. To clean the bags, simply empty the urine from the bag and leave the spout open for cleaning. Mix a cup of vinegar and a cup of cool water and flush the bag using a 50 ml syringe or by submerging the bag under the mixture. Once the bag is filled, close the spout and allow the liquid to stay in the bag for 30 minutes. Drain the cleaning solution and rinse the bag again with tap water. Hang dry with the cap off and the spout open. A commercially prepared urinary appliance cleaner may also be used as instructed. In terms of removing the catheter is held in place inside your bladder by a water-filled balloon. Cutting the collar next to the end of the part you have been plugging will cause the water inside the balloon to empty out and the balloon will deflate. You may then remove the catheter by pulling on it gently. It is important that when it is time to remove the catheter, do so in the morning, because you will need to urinate every 30 to 60 minutes on the day that you remove it. This is to keep the bladder empty and compressed and to allow itself to heal. This is especially important for the suprapubic incision for those with suprapubic catheters. After removing the suprapubic catheter in particular, cover the site with a Band-Aid for the first 24 to 48 hours. Drink at least 2 quarts of liquid a day. Avoid caffeinated drinks as they may irritate the bladder and cause bladder spasms. Please remember to call the office once a week until the catheter is removed with an update on your progress.